Hi, my name is Sadie. I'm a nurse here at Same Day at Passivant. Can you tell me your name and date of birth?
Rachel Kilver, 12/22/94.
And can you tell me the reason for your visit?
Checkup.
First, I'm going to be assessing your pain using cold spa, which is character, onset, location, duration, severity, pattern, and associated factors. So I'll ask you if you're having any pain anywhere, and then we will go from there using the cold spa. Next, I'm going to be inspecting the upper and lower extremities, just noting your color, temperature, and any deformities or masses that I'm seeing. We're looking for joint inflammation and swelling. I'll be palpating your elbow joints and your wrist joints, and like I said, we're going to be noting temperature, if I notice any swelling, any masses or deformities. Warmth could mean that you have some inflammation, which could mean arthritis, and you need to get that checked out some more. And then I also palpate the knee and then the foot and ankle joints, and we're also noting temperature, any masses, and the deformities. Next, we will be doing, I'm going to be inspecting peripheral vascular upper and lower extremities. So here I'm just looking for any clubbing, edema of the nails. We're going to be looking at skin turgor. We're going to be noting the size, color of your upper and lower extremities. I'll be doing your calf size. We'll also be doing the Holman sign, which is testing for DVTs, where I will push your foot towards your shin, asking if you have any pain in your shin. And if you do, that could be a sign of a DVT. We're also looking for any swelling and redness in the calf. I'm next going to be palpating the pulses in the legs, which is the femoral, the popliteal, which is behind the knee, the posterior tibial, and the dorsalis pedis on top of the foot. Next, I'm going to have you stand up so we can do range of motion together. We will be first starting with the head, going flexion, extension, hyperextension, lateral flexion, and rotation of the head. Good job. Next, we'll be doing shoulder, which is flexion, extension, hyperextension, circumduction, which is circling, abduction, and adduction of the arm. We'll move to elbow, which is flexion, extension, supination, pronation. Wrist is flexion, extension, hyperextension, radial deviation, ulnar deviation, which is just moving your wrist in and out. Fingers are flexion, extension, hyperextension. Flexion, extension, hyperextension, abduction and adduction of the fingers, and then your thumbs, flexion, extension, and then opposition, touching your fingers. Okay, we move on to the hip, which is flexion, extension, hyperextension, lateral flexion, and rotation. And then we'll do your hip joint, and it's flexion, extension, hyperextension is back, circumduction, abduction and adduction. And then we have eversion and inversion of your hip too. Just turn it in and out. We'll move on to the knee, which is flexion, extension, and then the foot, which is dorsiflexion, which is pointing up, and then plantar flexion, which is pointing down, and then your toes are the same as your fingers, flexion, extension, abduction, and adduction. Next, I'm going to be having you sit back down. I'm going to be assessing your thorax and lung region. Here I'm just looking for an overall, make sure there's symmetry of the chest, make sure that I don't notice one side's lower or upper than the other, looking for any barrel chest, or any signs with the diaphragm. I'm first going to be going behind the patient and doing asymmetric chest expansion, where I put my hands on the mid-back of the patient, asking them to take a deep breath, and my hands should rise and fall bilaterally and symmetrically, and my thumbs should go apart and back together the same. Here we're looking for any atelectasis on that. Next, we're going to be doing tactile fremitus, where I put my palms on your back in 5 different spots bilaterally on the lungs. Here I'm having you going to say 99,
99, 99, 99, 99, 99.
There I'm just feeling for vibrations on my palms, and if it's a decreased fremitus, you can have bronchitis or pleural effusion. Next, I'm going to percuss down your back on both sides bilaterally. Here I'm just feeling for pulses on the back, and we're doing that on 9 different spots in the back on both sides. And then next I'm going to auscultate the sounds, also on 9 different spots. They should be clear, we should have no wheezing, rhonchi, or rales, and there should be no decreased sounds at all. I'm also going to do this on the front. There are 5 spots on each side bilaterally, going from side to side, listening to them at the same time, making sure that both sides are equal. Also, they should be clear, no decreased sounds, no wheezing, rhonchi, or rales noticed. Next, I'm going to have you lie down on the bed, and I'm going to be palpating the apical pulse, which is found on the left side, or on the base of the heart on the left side. It's best done having the patient lie down, and we'll just making sure we can feel a good strong pulse. If you want to lie on your back, we're going to do the heart sounds. Starting with the aortic, which is on the right of the sternal, second intercostal space down, and then pulmonic, which is on the left of the sternal border, second intercostal space down, Erb's point, left sternal border, third intercostal space down, tricuspid, which is left of the sternal border, fifth intercostal space down, and then mitral valve, which is left of the sternal border, midclavicular line, fifth intercostal space down. And here we're listening for S1 and S2 sounds, making sure we're not hearing any murmurs. Next, we're going to be moving on to inspecting the abdomen. Here I'm looking at the abdomen contour. We're looking at the nutritional state, which could be flat to rounded, and this depends on how well the patient eats, if there's any issues going on with that in the nutritional state. First, I'm going to be auscultating in the 5 quadrants, the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Here we're listening for about 1 minute. We should hear 5 to 30 sounds in each bowel quadrant. Less than 5 is hypoactive, more than 30 is hyperactive. If we hear no sounds, you need to listen to 5 minutes in each quadrant. Next, I'm going to be percussing around the abdomen. Here we're just feeling for tympany. Any dullness could mean any distended bowel, and you'll do this in a clockwise motion, feeling for that vibrations and the dullness. Next, we will percuss, and you do this in a clockwise motion. You'll start doing light palpating, which is just about 1 centimeter deep. Here you're feeling the skin of the abdomen, looking for any outlining the organs, and then you'll do deep palpation, which is about 5 to 8 centimeters deep. Here you're feeling for any masses or deformities of the organs in the abdomen. Next, I'm going to also auscultate the vascular sounds in the abdomen, which are the aorta, which is upper abdomen, the renal, which is our 2 sides bilaterally, the iliac, and then the femoral sounds. Next, I'm going to move on to your cranial nerves if you want to sit up. First, we will be doing cranial nerve 1, which is olfactory, which is doing the smell. We'll have you close your eyes as you close the nostril, and then I'll have you smell. What do you smell?
Peppermint.
And we'll do the same on the other side.
Peppermint.
Making sure there's no issues with that. We'll move on to cranial nerves 5 and 7, which is trigeminal and facial. Can you say the words light, tight, dynamite?
Light, tight, dynamite.
There we're looking for voice articulation. Can you wrinkle your forehead, smile, frown, puff out your cheeks? There we're just looking to make sure all your face features are symmetrical bilaterally. I'm going to palpate your temporal mandibular joint, asking you to open and close your jaw, and I'm feeling for any clicking noises or tenderness. It could be signs that you have TMJ. We'll next move on to cranial nerves 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal. There, if you just want to stick out your tongue, move it side to side. There, we're just making sure your tongue's not deviated to one side at all. And then next, I'm going to have you stand up, and we're going to do this cranial nerve 11, which is the spinal accessory. Here, we're just going to be behind the patient. Ask the patient to bend over. We're going to be looking at the spine, making sure it's straight, that it's not going to one side or the other, make sure they don't have any deformities of the spine. I'm going to ask you to shrug your shoulders against my hands, making sure that they rise and fall at the same time. And then also I'm going to have you move your head to the left side, and I'm going to palpate the sternocleidomastoid muscle on each side, making sure that she has strong muscles. Next, you can sit down. We'll move on to the stereognosis, which I'm going to have you close your eyes, and I'm going to place an object in your hand, and you got to tell me what it is.
A key.
Okay, good job. And then we're going to do the graphesthesia, which I'm going to have you put your palm up And then I'm gonna write something on your hand. Close your eyes. And just tell me what I wrote.
13.
Yes. Next we move on to sensory. So I want you to put your sleeves up. And here we will do touch with a soft object and a sharp object. And she needs to tell me if it's soft or sharp and then where it's at on the body. So if you want to close your eyes.
Soft on my right arm.
Okay.
Soft on my left arm. Sharp on my right hand. Sharp on my left hand.
I'll also do this on the lower extremities to make sure that she has normal feeling everywhere. Next, we'll move on to the cerebellar function, which is we're going to first do rapid alternating movement, so just do this with your hands, making sure that you can do that fast and with the same rate. I want you to push and pull on my hands. We'll be doing muscle pull. And then I'll do the same with your knees, just press in and press out. And then we'll just assessing the muscle part of your joints, making sure that you have the same strength on both sides, upper and lower. Next, I'll be also having you, we're going to do the Allen test, which is testing to make sure you have good blood flow through your hand. So what you do is you hold down the ulnar and radial arteries, and you see that the color disappears in the hand, and then you let go of the ulnar and then let go of the radial, and you'll notice color returns back in the hand. That's called the Allen test. And then I'm also going to palpate the radial and ulnar pulses and also the brachial up here. Last, we will go over your health education, and I'm going to do this over range of motion and exercising, just because you're a young patient and you work out. So we would go over all those range of motion exercises. I'd also show you how to do like passive range of motion and how you just do that yourself.